Hi there, it's Dr. Solomon here, Chronic Pain GP once again, and today's video is about the use of opioids in the treatment and management of chronic pain conditions. So opioids are a class of drug which include drugs such as heroin, as well as the synthetic opioids, for example fentanyl, as well as prescription medications and other pain relief. It can be classified into varying degrees of potency, with codeine at the bottom and fentanyl at the top, with lots of different opiates and opioids in between. You'll probably notice that I'm using the words opioid and opiates interchangeably. And this is because opioids are derived from the opium poppy, which has been used for many centuries for pain relief, whereas the opiates are synthetic opioids which have been manipulated to varying degrees of potency and strength. Now, in primary care, as a GP, I often can prescribe varying degrees of opioids, including combination drugs such as cocodamol, but you can also prescribe MST, morphine sulfate, oxycodone, buprenorphine, which is a slightly atypical opioid, and fentanyl. Now, opioids can be used for acute pain, chronic pain to some extent, but probably most importantly, they should be reserved, in my opinion, for the end of life or palliative care. For acute pain, morphine is quite often used, for example, after an operation. Patients can have access to a morphine pump. But unfortunately, for chronic pain conditions, there is very little evidence that morphine or its derivatives are useful in the ongoing management. So how do they work? Well, what we do know so far is that pain from the extremities, from various stimuli, travels up to the spinal cord via nerves. To simplify slightly, these nerves have receptors on them or around them called mu receptors. What these receptors tend to do, if they're activated, is to slow down or block the signals. Now, the body itself can produce what we say is endogenous opioid-like molecules called endorphins. Now, these endorphins, which can sometimes be raised with exercise, for example, can stimulate the same receptors and can cause sometimes feeling of euphoria and also help block the pain signal. Unfortunately, due to the nature and duration of chronic pain, the natural produced endorphins are not enough to block the signals. So the opiates or opioids latch onto the mu receptor and help reduce the pain signals. However, the mu receptors are also present in the spinal cord and the brain. Therefore, unfortunately, there is a high risk of side effects. The opioids can activate the pleasure center of the limbic system, brainstem, which can cause problems with breathing. So unfortunately, it can be quite dangerous in overdose. Across the pond in North America, there have been many reported cases of deaths due to prescription opioids. In the United Kingdom, there has been a concerted effort to reduce our opioid prescribing, and I feel, in my opinion, that that is actually working. The overwhelming consensus is that opioids should not be used for long-term pain. Is that opioids can be useful for acute pain and perhaps flare-ups of chronic pain, as well as towards the end of life, what we say is palliative care and terminal care. Side effects due to the very nature of the opiates and opioids are quite predictable and include side effects such as constipation and the feeling of nausea as the most common ones. Other side effects can include constipation, dizziness, itchiness, dry mouth and sedation. Rarer ones include dependence and addiction. Respiratory problems have been reported. Sometimes in patients, use of opiates and opioids can cause worsening of pain. It's what we term hyperalgesia. And the best way to reduce this is to actually come off the opioids. Muscle pain is also has also been reported by patients. Other kind of wider side effects include reduced immunity, reduced sex drive or libido, and hormonal dysfunction. If you do decide to perhaps think about coming off opioids and opiates, I would strongly advise you make contact with your healthcare professional and come to an agreement about how to taper off them and come off them slowly. There's been lots of research with regards to opiates because they've been around for many years, and lots of research is coming out of North America and Europe, and often when clinicians get together along with scientists and public health officials, they put together guidelines, and some of the guidelines are available on the internet, for example, but I've summarised essentially what the main points are, and can include: when prescribing for chronic pain, or what we say is chronic non-cancer pain, non-opioid treatment is preferred for treatment of chronic pain. They've advised that you should only really use opiates and opioids when the benefit outweighs the risks. Patients and clinicians should establish treatment goals before starting treatment. If you do need to start them, it's always advisable to start low and go slow. Patients should have regular reviews of their medications, and patients should also avoid using other medications which can have a concomitant effect, such as diazepam. Patients are advised to avoid alcohol and other sedative drugs. There should also be a process where patients and clinicians are continually reviewing the benefits and the harms of using opioids. And if there is an increased need for morphine, patients and clinicians are advised that referral to pain specialists, such as myself or secondary care doctors, would be advisable. So in conclusion, opioids are a commonly prescribed medication in primary care and secondary care. However, there's very little evidence that they actually benefit patients in the treatment and management of chronic pain. Side effects are common, and unfortunately these types of drugs can cause dependence. After reviewing the use of opioids, including all the recent research, my conclusion is that it's a thumbs down for the use of opiates and opioids in the treatment and management of chronic pain conditions. Now, next time, I'm continuing the theme of pharmacological treatments for chronic pain. I'll be reviewing a group of medications which we use to treat chronic nerve pain, and these are termed neuropathic medications. Thanks once again for listening, and I just advise you to please subscribe, share this channel far and wide, would really help me as well. Leave any feedback down below, and I'll try and answer any questions or comments, and thank you once again for your time.